Hi, I'm Dr. Jose Lara from Gonstead Physical Medicine to talk to you about the importance of X-ray in finding the root cause of your lower back pain. In here, we can see a model of the spine looking at it from the side, a normal looking vertebrae, the space in between the vertebrae called the disc, and behind the disc is an opening called the foramina where the yellow structure comes out, which is a nerve. As we see on the X-ray, the same model will appear normal on an X-ray. In here, we have the normal looking vertebrae, the space that the disc will occupy, and the opening of the nerve coming out, the foramina. They all should be open the same way, and the space between the vertebrae or the bones should be equal. As we go down in the lower portion of the spine, we see that the space for the opening of the nerve decreases at this level called L4, and the spacing of the disc looks differently. As we go to L5, there's almost no space at all at the back of the vertebrae at the foramina, and the space in between the two bones, the L5 and the sacrum, is very well diminished. When we did the physical examination on this patient, we found lower back pain and pain going down the leg. As we see that, we need to determine where the pain is coming from. Looking at the X-ray, it was found that the pain was coming obviously from the two lower vertebrae. Without the X-ray, it is hard to pinpoint the root cause of the problem, which in turn will be almost impossible to give a solution or some kind of a correction to that cause of the problem. Knowing this, we know how to treat it, and then we know how far it will go. In this particular case, we're seeing a view from behind. The R amplifies the right side. This is the left side. This is the ilium or the hip area. The ilium should be level, should be balanced. As you can see, they are not. One is higher than the other one. And this structure right here, called the obturator foramina, is one larger than the other one. The spine looking from behind should be completely straight. As we can see in this particular patient, this has a rotation or deviation of the ilium and a tilt with a rotation of the spine. Now, the importance of X-ray in diagnosing the root cause of the problem and then in finding a way to correct it as much as the body will allow. In this case, if you think about this slight deviation to the right, if somebody was to push from the right to the left, it will increase this deviation. An X-ray is showing us the proper way to correct it. So first of all, you do not increase what's already wrong, but the opposite, you improve or at least stabilize what's already wrong. In this particular case, you will want to correct it from the left to the right, and the iliums will have to be lifted or adjusted to balance them out. This is another side view X-ray of the lumbar spine or the lower back. As you can see, in here we have what it should be a curvature, but it is not a curvature, it's completely straight. And then it takes a very sharp angle. What we would like to see is more like a reverse C curvature in the lumbar spine called the lordotic curvature. Now, this person has lower back pain. The importance of X-ray in finding out the root cause of the problem is to determine where the cause of the pain is coming from. If we look at this particular vertebrae or the bone, you could see that the shape of the vertebrae is somewhat changed from normal. The space between the vertebrae and the disc is less, and the opening in the back, the foramina where the nerve comes out, is a lot less. You have that at L4, at L5, at L3, some at L2, and if you notice from the sharp turn in this angle, it is because this particular vertebrae changed shape. This is what we consider a null compression fracture from a previous injury. So where is the pain coming from on this particular patient? The patient was physically evaluated, determined upon physical exam, and then related to the X-ray. So if you look carefully, this vertebrae in the back is almost even between L4 and L5. But as we go to this one is way posterior or backwards from the one below. So if somebody was to push this one forward, it will leave this one behind further, making it worse. So the importance of X-ray is to determine which one is which. The correction to this particular vertebrae is what addresses the root cause of the problem, and it helps fix the condition. In conclusion, as you can see, the importance of X-ray in finding the root cause of the problem is vital in helping us determine and develop way of treat the condition, give it the best way to correct it, the proper angle, the proper direction, whether it's a chiropractic adjustment or spinal decompression. Without the x-ray, it will be almost impossible to see how to correct it, and that is why we get such great results here at Gonstead Physical Medicine.